Somewhere in Australia right now, there is a 61-year-old who has been paying an invisible tax for the last decade, not because they broke any rules, not because they did anything dishonest, but because nobody ever told them about a single form they could have filled out in 15 minutes. The amount they've overpaid is somewhere between $8,000 and $14,000, depending on their income. It went to the ATO, not to their health, and the frustrating part is that every single dollar of it was avoidable. Medicare is the most used government system in Australia. Most Australians interact with it dozens of times a year, and yet the rules around what it costs you, what it doesn't cover, and how to use it correctly are almost never explained clearly, especially to Australians approaching and entering retirement, where the stakes are highest and the gaps are widest. Today I'm walking you through 6 Medicare mistakes that are costing Australians over 60 real money every single year. The case studies that show exactly how it happens and what to do about each one before another year goes by. Medicare is not free. Most Australians know they pay the Medicare levy, 2% of their taxable income, and assume that covers their obligations. It doesn't. There is a second layer, a third layer, and a series of entitlements most people never claim because they simply don't know they exist. For Australians over 60, the stakes around getting Medicare right are particularly high. Healthcare costs increase with age, interaction with the medical system becomes more frequent, and the financial decisions made in this decade about private health insurance, about chronic disease management, about what Medicare actually covers in a hospital, have consequences that compound over years, not months. The 6 mistakes I'm covering today are not rare edge cases. They are the most common errors made by ordinary Australians in the 55 to 70 age bracket, and the combined cost of making all of them over a 10-year retirement runway easily exceeds $10,000 per person. This is the most expensive Medicare mistake in dollar terms, and it is made by hundreds of thousands of Australians every year. The Medicare Levy Surcharge is an additional tax on top of the standard 2% Medicare levy that applies to individuals earning above $93,000 and couples earning above $186,000 who do not hold adequate private hospital cover. In 2026, the surcharge rates are 1% for those earning between $93,000 and $1 and $108,000, 1.25% for those between $108,000 and $1 and $144,000, and 1.5% for those earning above $144,000. For a single person earning $120,000 with no private hospital cover, the MLS costs $1,500 per year. Over 10 years, the typical gap between 55 and retirement, that's $15,000 paid directly to the ATO. That provided zero additional health coverage in return. Consider the case of Margaret, a 59-year-old nurse earning $104,000. Margaret never took out private hospital cover because she worked in the public system and assumed she understood Medicare better than most. She was paying $1,040 per year in Medicare Levy Surcharge when she finally compared that to the cost of a basic hospital cover policy, which in her age bracket can be found for between $1,100 and $1,400 per year. She discovered the surcharge and a compliant policy cost almost identical amounts. The difference was that the policy actually gave her coverage, including access to private hospitals, reduced waiting times, and extras cover for dental and optical she hadn't had in years. The action here is straightforward. If your income exceeds $93,000 and you don't currently hold private hospital cover, calculate your exact MLS cost at your income level and compare it directly to the premium of a compliant hospital policy. In most cases, at incomes above $100,000, the policy costs the same as or less than the surcharge, and it actually gives you something. The Medicare Safety Net is one of the most underused entitlements in the Australian healthcare system, and for Australians over 60 who see specialists, surgeons, or allied health professionals regularly, it can be worth thousands of dollars per year. Here is how it works. Once your out-of-pocket Medicare costs in a calendar year exceed a certain threshold, Medicare begins covering a significantly higher proportion of your remaining costs. In 2026, the general safety net threshold is $531.70. Once you cross it, Medicare pays 100% of the Medicare schedule fee for all subsequent out-of-pocket costs for the rest of that calendar year. The extended Medicare safety net threshold for singles is $811.80, and for families and concession card holders, $811.80 as well. Once you cross the extended threshold, Medicare covers 80% of your out-of-pocket gap fees for all further services. For someone seeing a cardiologist, an ophthalmologist, and a specialist physiotherapist regularly, which describes a significant proportion of Australians over 60. Crossing both thresholds is not unusual. The mistake is not registering as a family. If you and your spouse are both incurring out-of-pocket costs, registering as a family unit means your combined costs count toward the threshold together, reaching it faster and triggering the safety net benefits sooner. Families who don't register are counted as individuals, which means they may each independently fail to reach the threshold, while their combined costs would have triggered it months earlier. To register your family for the Medicare Safety Net, call Medicare on 132-011 or do it through your MyGov account. It takes less than 5 minutes and can be backdated to the start of the current calendar year. This is the mistake that costs the most over a lifetime, and it is completely irreversible once made. Australia's lifetime health cover loading system works like this. If you don't take out private hospital cover by the July 31st following your 31st birthday, you pay a 2% loading on your premium for every year you delay, up to a maximum of 70% loading. That loading stays on your premium for 10 continuous years of coverage before it begins to drop, and in practice, most Australians who take out cover late carry some degree of loading for the remainder of their insured lives. Consider the case of James and Helen, a couple who both took out private hospital cover at 58, having never held it in their adult lives. The loading on both policies was 54%, 2% for every year between 31 and 58. Their base premium for a mid-level hospital policy was $3,200 per year each. With the 54% loading applied, they each pay $4,928 per year, an extra $1,728 per person per year, for coverage that is identical to someone who took out the same policy at 31 and pays $3,200 over the 10-year loading period. James and Helen each pay $17,280 more than they needed to, a combined excess cost of $34,560, purely because of timing. For Australians currently under 31 watching this, take out a compliant hospital policy now, even the most basic one available, and hold it continuously. For those already carrying loading, understand that the loading drops by 2% for each continuous year of coverage, and reaching 10 years of continuous cover will eventually eliminate it entirely. This is the most common missed entitlement among Australians over 60, and it costs patients money every single year it goes unclaimed. A chronic disease management plan, previously called an enhanced primary care plan, is a Medicare-funded arrangement that your GP can set up. If you have a chronic medical condition, it entitles you to up to 5 subsidized visits per calendar to allied health professionals, including physiotherapists, podiatrists, diabetes educators, dietitians, audiologists, and occupational therapists. Each of those visits attracts a Medicare rebate of $58.30 per session in 2026. 5 sessions per year represents $291.50 in Medicare rebates. That tens of thousands of Australians with conditions like diabetes, heart disease, arthritis, chronic back pain, or hearing loss are simply not claiming because their GP has never mentioned the plan exists. The case of Robert, a 64-year-old with type 2 diabetes and chronic lower back pain, illustrates this precisely. Robert was paying $95 per physiotherapy session out of pocket, seeing his physio 6 times per year. He had never been referred to a CDM plan. When his new GP set one up, 5 of those 6 sessions attracted a $58.30 Medicare rebate each, reducing his annual physio cost from $570 to $278.50. Over 5 years, that's a difference of $1,457.50. From a single conversation with his GP, that took less than 10 minutes. If you have any chronic condition, not just major ones, ask your GP directly, am I eligible for a chronic disease management plan? That question, asked once, can generate hundreds of dollars in annual savings for as long as your condition persists. This is the misconception that generates the most financial shock, and it typically arrives in the form of a bill after a procedure at a moment when the patient is least equipped to deal with it. Medicare covers 75% of the Medicare benefit schedule fee for in-hospital procedures. Your private health insurance, if you hold it, covers the remaining 25%. Together, those two sources of coverage sound like they should add up to 100%. They frequently don't. The gap emerges because many specialists charge above the Medicare benefits schedule fee, sometimes significantly above it. The difference between what the specialist charges and what Medicare plus your insurer pays is called the gap fee, and it is paid entirely by you, out of pocket, with no Medicare or private insurance contribution. In 2026, average specialist gap fees for common procedures range from $200 for a straightforward consultation to several $1,000s for surgical procedures, and there are no caps on what a specialist can charge above the schedule fee. Consider the case of Patricia, a 67-year-old who required hip replacement surgery. She held mid-level private hospital cover, had Medicare, and assumed her out-of-pocket costs would be minimal. Her final bill included a $2,400 anesthetist gap, a $1,800 surgical assistant gap, and a $600 specialist consultation gap, none of which were covered by Medicare or her insurer. Her total unexpected out-of-pocket bill was $4,800. Every one of those gaps could have been avoided or significantly reduced by choosing a specialist who participates in her fund's gap cover scheme, a list available from every private health insurer on request. Before any elective hospital procedure, ask 3 questions. Does my specialist participate in my fund's gap cover scheme? What will the anesthetist charge? And do they gap cover? And what is my estimated total out-of-pocket cost before I confirm the booking? This is the assumption that costs more as you get older, because the older you are, the more you need exactly the services Medicare doesn't cover. Medicare does not cover routine dental treatment. It does not cover optical, glasses, contact lenses, or routine eye tests beyond an optometry consultation every 3 years. And it does not cover physiotherapy, psychology, beyond a limited number of referral-based sessions, or hearing aids, except through specific government schemes. For Australians over 60, whose healthcare needs increasingly include these services, this gap between what people assume Medicare covers and what it actually does can represent thousands of dollars per year in unexpected out-of-pocket costs. There are targeted government programs that partially address this. The Australian Government Hearing Services Program provides subsidized hearing devices and services to eligible Australians, including those holding a pensioner concession card, a Commonwealth Seniors Health Card, or a DVA card. The Child Dental Benefits Schedule does not apply to adults, but some state-based public dental schemes provide limited subsidized access for eligible concession card holders. And for Australians with a diagnosed mental health condition, a mental health treatment plan from a GP provides up to 10 subsidized psychology sessions per calendar at a Medicare rebate of $137.05 per session in 2026, a total potential benefit of $1,370.50 per year that thousands of eligible Australians don't claim because they simply don't know it exists. The action here is a full audit of what you currently pay out of pocket for health services each year. Dental, optical, hearing, physiotherapy, psychology, and a review of which government programs, concession entitlements, and private health extras covers apply to your specific situation. 6 mistakes, all of them avoidable with the right information at the right time. Here is exactly what to do this week. First, check your income against the Medicare Levy Surcharge thresholds. If you earn above $93,000 without private hospital cover, calculate your exact surcharge cost and compare it to a compliant policy premium today. Second, register your family for the Medicare Safety Net through MyGov or by calling Medicare on 132-011. It takes 5 minutes and can be backdated to January 1st of this calendar year. Third, if you took out private hospital cover after age 31, log into your fund's portal and find your lifetime health cover loading percentage. Understand how many continuous years of coverage you need to eliminate it. Fourth, ask your GP at your next appointment whether you are eligible for a chronic disease management plan. If you have any chronic condition whatsoever, the answer is very likely yes. Fifth, before your next elective hospital procedure, call your private health insurer and ask specifically which specialists and anesthetists participate in their gap cover scheme. Then request only those practitioners. Sixth, do a complete annual health spending audit. List every out-of-pocket cost for dental, optical, hearing, and allied health, and cross-reference each one against available government programs and your fund's extras cover. Medicare was designed to make healthcare accessible to every Australian. But accessible doesn't mean automatic, and it certainly doesn't mean complete. The Australians who get the most out of the system are not the ones who are sicker or older or louder. They are the ones who understand the rules, ask the right questions, and check their entitlements before the bills arrive, rather than after. None of the 6 things I walked you through today require a financial advisor, a lawyer, or any specialist knowledge. They require 15 minutes, a MyGov login, and a conversation with your GP. If this video saved you money, you didn't know you were losing. Subscribe and hit the notification bell. More straight-talking Australian finance content every week. Thanks for watching. I'll see you in the next one.